Chaque jour, partout dans la province, des gens du Nouveau-Brunswick retroussent les manches pour contribuer à se protéger et à protéger leurs familles et leur communauté. Notre campagne de vaccination contre la COVID-19 connaît un succès retentissant. We are setting and breaking records each week for the number of appointments booked and vaccines administered. While the first vaccine dose does not provide full immunity from COVID-19, it will reduce the risk of serious illness, hospitalization, and death from this disease. Cette semaine, nous serons parvenus à administrer au moins une dose de vaccin à 50% de la population. C'est tout un exploit pour notre province et je tiens à remercier tous ceux et celles qui ont contribué. But there is more yet to do. As the supply of vaccines from the federal government has grown, we have given more New Brunswickers the opportunity to become vaccinated. Since mid-April, we have reduced the age of eligibility each week. I'm hearing a little echo there. I don't know if everybody's muted.
Everybody, please mute your microphones. S'il vous plaît, mutez vos micros, s'il vous plaît.
Last week, we made the vaccine available to every New Brunswicker over the age of 30, and today we are opening our COVID-19 vaccine campaign to all New Brunswickers over the age of 18. Aujourd'hui, nous ouvrons la vaccination contre la COVID-19 à tous les citoyens du Nouveau-Brunswick de plus de 18 ans. You can book an appointment with your local participating pharmacist or through a vaccine clinic offered by the Horizon and Vitalité Health Networks. Minister Cardy will have more to say about our vaccine program and on our plans to extend vaccine eligibility to school-age children over the age of 12. This further expansion of our vaccination effort is very good news for New Brunswick, but we must continue to be cautious and vigilant. Il continue d'y avoir beaucoup d'expositions potentielles du public, surtout dans la région de Fredericton ces jours-ci. Nous avons affaire à deux nouveaux variants du coronavirus qui sont plus contagieux et peuvent se propager différemment du virus initial. We continue to see a large number of potential public exposures to the virus, particularly in the Fredericton area at this time. Public health guidance and advice. This applies equally for the vaccinated as well as the unvaccinated. Nous devons tous continuer à nous laver les mains régulièrement et soigneusement. Cela contribuera à freiner la propagation de l'infection. It is vital that everyone continue to wash their hands regularly and thoroughly or use hand sanitizer when in public places. This will help prevent the spread of infection. We must all continue to wear a mask when in public places and maintain 2 meters of physical distance from others whenever possible. These actions create a barrier that the virus cannot cross. Please check the list of public exposure notices every day. They can be found on the Government of New Brunswick website, and I have to say that many people who do come forward because of this type of public exposure notification, we do find cases this way, so it is really helpful. If you have been in a location where an exposure to COVID-19 may have happened, you can get tested right away. You don't have to wait for symptoms to emerge. And I encourage anyone who has been in a public exposure setting to seek testing as quickly as possible. The sooner we can identify and isolate new cases, the sooner we can limit the spread of any new outbreaks. Aujourd'hui, Santé publique annonce qu'il y a 10 nouveaux cas de COVID-19 au Nouveau-Brunswick. Tous les cas signalés aujourd'hui se trouvent dans la province. Dans la zone 3, soit la région de Fredericton et de la vallée de la rivière Saint-Jean, il y a 9 nouveaux cas. 2 de ces cas sont directement liés à des voyages, 5 sont des contacts de cas confirmés auparavant et 2 font l'objet d'une enquête. Il y a aussi un nouveau cas dans la zone 6, soit la région de Bathurst et de la péninsule acadienne, qui est directement lié à un voyage. Il y a maintenant 122 cas actifs de COVID-19 dans la province. Ce chiffre comprend les 18 néo-brunswickois infectés qui s'isolent actuellement à l'extérieur de nos frontières. Il y a présentement 10 citoyens du Nouveau-Brunswick qui sont hospitalisés en raison de la COVID-19, dont 3 aux soins intensifs. Ce chiffre comprend les 4 néo-brunswickois qui sont hospitalisés dans d'autres provinces, dont 1 aux soins intensifs. Today, Public Health is reporting 10 new cases of COVID-19 in New Brunswick. All of today's cases were reported within the province. In Zone 3, which is Fredericton and the St. John River Valley, there are 9 new cases today. 2 of these cases are directly related to travel, 5 are contacts of previously confirmed cases, and 2 are under investigation at this time. There is also 1 new case in Zone 6, which is the Bathurst and the Acadian Peninsula area, directly related to travel. There are now 122 active cases of COVID-19 in New Brunswick, and this includes 18 New Brunswickers who became infected and are self-isolating outside of the province. There are also 10 New Brunswickers now hospitalized with COVID-19, including 3 who are under intensive care. This includes 4 New Brunswickers who are in hospital and in other provinces, one of whom is in ICU. With the large number of public exposure incidents, we are also seeing more New Brunswickers self-isolating to help us slow the spread of the virus. Je tiens à remercier les 871 personnes qui s'isolent actuellement un peu partout dans la province de leur diligence et de leur sacrifice. I would like to extend my thanks to the 871 people now isolating across the province for their diligence and their sacrifice. In particular, I want to offer thanks and support to the staff of the Delta Hotel and the Hilton Hotel in Fredericton and their families. This is a stressful time for staff and families at the Delta, Fredericton, and the Hilton Garden Inn, and they need the support of their friends and neighbors. If you have family or friends now self-isolating, please reach out to them and offer whatever assistance you can provide, such as dropping off mail, groceries on a doorstep, or connecting by phone or virtually. Public Health is continuing to monitor the situation in Zone 3, which now has 46 active cases, and I can say that some of the cases are the India variant of concern, and some of the new cases that are travel-related are not connected to that cluster, and therefore the sequencing has found them to be a different variant. So the cases in Zone 3 represent more than 1/3 of all the active cases in the province, and we have seen some encouraging signs thus far. So to date, we have no hospitalizations in the Fredericton area due to COVID, and almost all of the infections we have identified appear to be linked to existing cases. However, the situation can change literally overnight. We have all worked hard to bring the entire province to the yellow alert level, and we want to keep each zone at this level if we can. But as we have done in the past, Public Health will not hesitate to impose new restrictions on public movement to slow the spread of this virus. That's why it is so very important for people in New Brunswick, particularly in Fredericton, and in every corner of our province to follow public health guidance and advice. Please refamiliarize yourself with the symptoms of COVID-19 and watch for the signs in yourself and in your family. If you have been in a place where a public exposure has been reported, please get tested. If you have been contacted by public health contact tracing teams, please follow their direction to the letter and get tested if they ask you to be tested. This is so very, very important, again, to help contain the spread. We are so grateful for the hard work to stamp out the cases linked to the University of New Brunswick's Fredericton campus. Great, amazing work for that, as well as George Street, Fredericton High, and Nashwaaksis Middle School, and also Leo Hayes. There are so many people working so very, very hard right now, so I thank them all. We are hopeful we can contain the cluster linked to the Delta Fredericton, but many public exposures in multiple settings make this very challenging. We need all hands on deck and everyone's full cooperation. Et n'oubliez pas de vous montrer bienveillant à l'égard de ces personnes. Elles accomplissent un travail d'une grande valeur, soit celui de vous fournir des renseignements qui vous aideront à vous protéger, vous, votre famille et votre communauté. Yes, everyone is weary of COVID-19, but I am asking you to stay the course with us. Help us continue to protect all New Brunswickers. We have come so far, but we need to work together to get through this next phase of our pandemic journey. And I think I have one more item to add to my notes. It is with a heavy heart that I announce today that New Brunswick has experienced another death due to COVID-19. This is an individual aged 70 to 79 who has passed away at the Edmundston Regional Hospital. And this person was a resident of the Pavillon Beaulieu in Grand Falls. This is the 42nd death from COVID-19 reported in our province since the pandemic began, and it will never be easy to report on these events. Each New Brunswicker we have lost has a family, friends, and loved ones who cherish them, and we all share in your sorrow and grief. Thank you very much.
Good afternoon, everyone. Bonjour. I'd like to reiterate the condolences that Dr. Russell extended to the family of the nursing home resident who passed away today in this last, hopefully last stage of our fight with this pandemic. Continue to see the casualties from it. And it's a constant reminder to us about the importance of following the advice from public health, making sure that we listen to the directives that we've become all too familiar with over the last number of months. As we continue that struggle between getting New Brunswickers vaccinated and the progress of the disease and new variants that appear, last night a positive case of COVID-19 was confirmed at New Maryland Elementary School. And the school community has been notified. And so that school is closed today for allow for operational response plans to be rolled out, and students will move to distance learning on Wednesday and Thursday at least. And as a result of an exposure within the school, Public Health has also advised a significant portion of the staff and students, along with their families, to self-isolate until 11:59 p.m. on Thursday evening. This is out of an abundance of caution. Certainly in the last phase of this battle, we do not want to let our guard down. We know these situations are stressful. We know they cause anxiety. I want to thank everyone for their ongoing cooperation and their adherence to Public Health's advice. We also have a positive case confirmed at New Maryland Kids Club last night, an early child care education center. And impacted families were notified, and the child care facility will be closed for the next 3 days. Since the last update, a third COVID case has been confirmed at Leo Hayes High School in Fredericton, and the high school has moved to online learning until at least Thursday, May 20th. And I know that many families within the school community are feeling anxious right now, but at this time there has been no in-school transmission identified at Leo Hayes. And remember that all close contacts will be contacted by Public Health directly as part of our excellent contact tracing efforts, and as usual, no news is good news. Our outbreak management plans were developed to reduce the risks, to support contact tracing, and to minimize the impacts on learning. And so far, they have worked well, and we're going to continue to follow them. Because I know this school year has not been easy, and staff and students have had to adapt to an incredibly fluid and quickly changing situation, sometimes on a moment's notice. But throughout all of this, I've heard the incredible collaboration between students and staff in classrooms and in schools across our province. And they've been kind, and they've been patient, and have shown real innovation in the ways that they engage with one another, and the ways they learn. And the students and the staff have been following the masking policies, physical distancing requirements, good hygiene and respiratory etiquette, and other preventative measures outlined in each one of our nearly 300 schools' operational plans that are each tailored for the specific needs of that school and the community that they serve. Alors, j'encourage chacun à jouer son rôle pour mitiguer les risques autant que possible dans nos écoles et dans toute la province. Je suis très reconnaissant de l'incroyable niveau de coopération pour assurer la santé et la sécurité des salles de classe. Cela dit, nous savons qu'une fois hors de la salle de classe, il est facile de se laisser aller à un faux sentiment de confort. C'était une longue hiver et cette semaine, on a l'impression que l'été est finalement arrivé, mais ce n'est pas le moment d'abandonner toute prudence. Nous donnons l'exemple à nos apprenants. Vos actions et les risques que vous prenez déterminent si les élèves de Nouveau-Brunswick pourront continuer à recevoir le soutien et les services dont ils ont besoin pour réussir dans un environnement sain et sûr. We are continuing to make excellent progress in our vaccine rollout, but we can't let our guard down just yet. There's 5 weeks left in the school year, and we need your cooperation to make every last one of them count. So thank you to the dedication of the professionals working behind the scenes. And because of their work, today we're able to announce a further expansion of our vaccine rollout to include another age group. So as of today, New Brunswickers who are 18 years of age and older are eligible to book their vaccine. Appointments can, as always, be booked by calling a participating pharmacy or through a clinic provided by Horizon or Vitalite Health Networks. And the vaccines available at those clinics and pharmacies right now are the Moderna vaccine and the Pfizer-BioNTech vaccine. The Pfizer-BioNTech vaccine and Moderna work in the same way and have similar levels of effectiveness. And I want to take this opportunity to reassure the folks who've reached out to me with concerns about AstraZeneca and some of the public statements that have been made on that subject. All of New Brunswick's leaders have had access to the same information and were on the same page when it came to information on COVID-19 and our response to it. It's one of the things that's caused us to be a world leader in our battle against the pandemic. Our team, your team, looked at the science and we came together with a single message. The all-party COVID committee, the government, one team NB, one message. And contrary to some of the reports, we are continuing with the use of AstraZeneca. First shots are on hold because of a supply issue, but when we receive new AstraZeneca doses, New Brunswickers will have another choice to get vaccinated and to help put this pandemic behind them and behind us, to breathe easier, to know their loved ones are protected and their communities and themselves. And I can understand why New Brunswickers are concerned about AstraZeneca. There were confused messages from Ottawa and from other provinces. But the great thing about science is that it's never confused. It either stands up for scrutiny or it doesn't. And in this case, we know that AstraZeneca can cause, in very rare circumstances, some serious side effects. We've seen with the tens of millions of AstraZeneca doses administered around the world, a tiny number of serious side effects. And at the same time, we have seen hundreds of thousands of deaths from COVID-19. So when it comes to science and when it comes to risk, the answer is clear. The United Kingdom has relied on AstraZeneca, 37 million shots administered. Deaths from COVID down by 99% since January. And yesterday, the UK government relaxed their COVID restrictions, allowing people to hug again. Oxford University's Regius Professor of Medicine, Sir John Bell, talking about Canada's approach in AstraZeneca, has said that unfortunately we have too often acted on a lot of hearsay and not facts. And as he said, at my last look, you guys are 3.6% vaccinated with 2 doses, so just wait for the B1617 variant to rip through the Canadian population, and then the problems you've had with these very rare clotting events will look pretty insignificant. And look, no one is being forced to take any vaccine, but this is not a question of which vaccine is riskier. It's about what is riskier: another year of COVID, another year of masks and distance and fear, or 2 shots and freedom. So while I understand the fear that some people have, I'm asking all of us to join together as New Brunswickers, to get through this, to listen to the science, but even more, to get behind our loved ones, the folks in our community suffering from sickness and from anxiety. So please, for your province, fight that fear and take that first shot. And for everyone who's eligible, you can book your appointment online at www.gmb.ca/ and then this is all one word, book a vaccine. And if you can't book online, or if you couldn't understand me reading out that email or that website address, you can call 1-833-437-1424. We are doing so well with implementing our vaccination plan because New Brunswickers are rolling up their sleeves for that first shot. And a new single-day record for COVID-19 vaccinations was set on Friday, May 14th, with 11,535 doses administered across our province. And as of 8 a.m. on Monday morning, New Brunswick had the highest percentage of its population vaccinated of any maritime province. Over the last 7 days, 48,134 people have been recorded as vaccinated. This is the highest 7-day rolling average since the campaign began. And as of this morning, a total of 330,110 New Brunswickers have been reported as vaccinated with at least 1 dose. We're expecting to get to 50% this week, by the weekend at the latest. And our target is to vaccinate more than 75% of New Brunswickers with both doses. And how we're going to get there is if people keep on stepping up to get that shot. It's not the time to be hesitant. It's the time to listen to public health, book an appointment and get your vaccine. I encourage everyone to do your part, and since this pandemic began, we've always had to be flexible. As new information has become available, we've had to change our approach as science dictated. And it hasn't always been easy, but over and over again, New Brunswickers have proven themselves up for the challenge. In working together, we have put the health and safety of our loved ones and our communities first, and I'm asking you to continue doing that. And if we could ever hope to get ahead of this pandemic, vaccines are our only way out. So please have faith in the science and do your part for your province. Because every person who gets vaccinated is taking a positive step towards helping move our province through COVID-19. So right now we are in the planning phase, but we do hope to lower the eligibility age even further in the coming days to further increase the number of New Brunswickers who can receive at least the first dose of COVID-19. And the Department of Education and Early Childhood Development is continuing to work closely with Public Health on the vaccine rollout plans for those aged 12 and up. So stay tuned on that one. And our goal there is to make this process as easy as possible for families, and by working together and getting vaccinated as soon as we can help keep our schools healthy and safe as we start the process of planning for a new year. Nous avons hâte de partager plus de détails à ce sujet la semaine prochaine, une fois que nos plans seront finalisés. Et d'ici et là, s'il vous plaît, soyez tous vigilants. Plus nous ferons attention maintenant, plus vite nous pourrons mettre un terme à cette pandémie. Faites-vous vacciner. Continuez à vous masquer. Gardez vos contacts proches à un niveau bas. And we are so close to this finish line now. So close. So let's keep each other safe just a little while longer and hopefully enjoy a great, nearly post-COVID New Brunswick summer. Merci. Thanks so much.
Thank you, Minister. Thank you, Dr. Russell. Merci beaucoup à vous deux. We'll now proceed with questions from members of the media. Each reporter will have one question and the quickest follow-up ever. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question et un suivi très rapide. Voulez-vous assurer de désactiver le son de vos micros? Before we commence, Dr. Russell has something to say.
Je voulais juste répéter en français ce que j'avais dit tout à l'heure en anglais, que c'était avec beaucoup de tristesse que je vous annonce aujourd'hui qu'une autre personne du Nouveau-Brunswick a perdu la vie. Cette personne, âgée de 70 à 79 ans, est décédée à l'hôpital régional Edmundston. Il résidait au pavillon Beaulieu à Grand-Sault. Il s'agit du 42e décès attribuable à la COVID-19 dans notre province depuis le début de la pandémie. Il ne serait jamais facile de faire l'annonce de ces décès. Chaque personne qui nous a quittés laisse derrière elle une famille, des amis et des proches qui les aimaient tendrement. Et nous partageons tous votre peine et votre deuil. And I just wanted to make one other reminder. I did mention in my notes earlier that as of today, we are opening up our COVID-19 vaccine campaign to include all New Brunswickers over the age of 18. Aujourd'hui, nous ouvrons la vaccination contre la COVID-19 à tous les citoyens du Nouveau-Brunswick de plus de 18 ans.
Jean-Philippe Hughes, Radio-Canada.
Oui, bonjour. Alors, hier, on était rendu à 25 infections liées au Delta de Fredericton. Je ne sais pas s'il y a des nouveaux cas parmi les 9 du jour de la zone 3 qui font partie de cette éclosion. Ma question, c'est pour Dr. Russell. Jusqu'à présent, est-ce que vous pensez que l'isolement dans les hôtels, ça a aidé à diminuer ou à augmenter le total des cas de COVID de manière générale dans la province?
Oh, je m'excuse, pouvez-vous répéter?
La dernière portion de votre question, M. Hughes.
Oui, bien sûr. La question, en fait, c'est jusqu'à présent. Est-ce que vous pensez que l'isolement dans les hôtels désignés a participé à diminuer ou à augmenter le total des cas de COVID-19 dans la province?
C'est une bonne question. Je ne crois pas qu'on pourrait dire oui ou non à ce moment-ci. Je crois qu'il faut attendre que tout est résolu avec les éclosions et on est dans une place qu'on peut faire l'analyse après tous les cas sont comptés et ça va prendre des mois pour voir s'il y avait une différence. Ça va être aussi difficile à dire si c'est une différence parce que la raison qu'on l'avait faite, c'est parce que les variants sont plus contagieux. Et ça veut dire que les gens doivent s'auto-isoler dans une façon plus sécuritaire qu'avant les variants sont arrivés ici au Nouveau-Brunswick.
Monsieur Hughes, as-tu un suivi?
Oui, j'ai un suivi. C'est sur un autre sujet, par exemple. C'est au sujet de la vaccination des travailleurs dans les établissements de soins de longue durée. C'est dans les zones 4 et 6, donc le nord-ouest du Nouveau-Brunswick et la région Bathurst péninsule acadienne, que le pourcentage de travailleurs vaccinés est le plus faible dans la province. Quels moyens vous proposez pour vous assurer que la COVID-19 n'entre plus dans les foyers de soins par l'entremise des travailleurs non vaccinés?
C'est une très bonne question. Je faisais partie des discussions avec le développement social au sujet de leur plan d'action pour essayer d'augmenter le taux de vaccination avec les travailleurs de santé dans les foyers de soins et les résidences à long terme. Et c'était vraiment quelque chose de très inclusif et qui appuyait les gens pour essayer de donner l'information, l'éducation et aussi faire certaine que c'était facile d'avoir les vaccins. Je crois que, fur et à mesure que la population ici au Nouveau-Brunswick recevront tous leur deuxième dose, environ 75% de la population. Ça, c'est notre but d'ici au commencement du mois de septembre. On verra la transmission et les nombres de cas diminuer. Mais d'ici à ce temps-là, c'est possible qu'on va encore voir des éclosions, mais on espère que les taux, les nombres de hospitalisations et les décès seront diminués aussi, au fur et à mesure qu'on aura plus de la population vaccinée.
Merci beaucoup. Hidil Ibrahim, CBC.
Thank you. This question is for Dr. Russell. Dr. Russell, regarding the residents of UMB's McGee House, are they still in isolation? If so, how many? Why weren't they released on Sunday as expected, and what is their new release date?
Great question. I'm going to have to get back to you on that one. I don't have that information in front of me, but I can get it for you.
Follow-up,
Okay,
Hidil?
but you can confirm that they weren't all released?
Can't confirm anything. I don't have any information about the UNB. I don't have any information in front of me on the UNB cases and those folks that were close contacts and isolating. Sorry.
That's okay. For the second question, what safety training did Fredericton Delta employees receive about dealing with isolating guests, and if any changes have any changes been made to those guidelines for staff of the new isolation hotels?
I think in a general sense, I can really only speak to what's happening moving forward. I don't have very much information on the initial hotels other than JPS and Red Cross worked closely together. Public Health was part of those discussions. And as of right now, Prompt and Red Cross are on site at the Delta. But in terms of moving forward in the new isolation hotels, everything that needed to be done to ensure that there was no risk of any kind of transmission has been worked on, and that's again, public safety has been leading that, and they've been working closely with Red Cross, and they would have had some input also from WorkSafe and also some input from Public Health.
Thank you, Ms. Ibrahim. Vicky Hogarth, CHCO TV.
Thank you, Bruce. Dr. Russell, can you please elaborate on why 75% is the magic number when it comes to a vaccination target and achieving herd immunity? And do you think we're on schedule to achieve that by July 1st?
I think we're on target to achieve that. If you remember, the initial targets were actually much lower. I think the initial national target, and even provincially, was probably around 65%. But those numbers and targets changed once the variants of concern arrived on the scene and changed the risks in terms of transmission and outcomes with respect to severe symptoms and need for hospitalization and risk of death. So we're aiming higher now as a result of that. And also, we do have data from places like Israel and the UK who are ahead of us right now in terms of their vaccination rates. And so I think it will be, what's realistic, what is going to be the thing that's going to keep us the safest, and obviously the higher that number is, the better.
Ms. Hogarth, do you have a follow-up?
I do. It's for Dr. Russell and or Minister Cardy. Does it look as if we might be able to make New Brunswickers age 12 and up eligible for the vaccine before the school year is out? And if so, are you discussing the idea of possibly holding vaccine clinics in schools?
Hey, thanks for the question. So we're certainly going to be doing our best to start the process of getting those students vaccinated the very second that public health gives us the okay. There are lots of logistics, obviously, around having vaccine clinics in schools. And one of the issues is that right now, the only vaccine approved for that age group is Pfizer, which is the most difficult to store. It's the one that requires incredibly cold temperatures to be able to survive. So that makes that more complicated, but we are working to try and come up with a plan that will get as many of those students in that age category vaccinated as quickly as humanly possible.
Thank you, Ms. Hogarth. Laura Brown, CTV.
Hi, Dr. Russell. I'm wondering how many cases are now connected to the Delta Hotel, and why is it not considered an outbreak? At UNB, it just took 2 cases. Why is that not considered an outbreak?
Great question, Laura. So some of the original cases, I believe, from the Delta, they're not all there currently. So this could have been a guest, it could have been staff that then included in that 25 in total that are linked, could be household members, could be close contacts outside of the household in other settings. So when we say that they're linked to the Delta, they had some association in terms of the original transmission. So when we talk about outbreaks in places like a long-term care facility, et cetera, those are closed settings. So the people aren't coming and going in the sense that once an outbreak is declared, the residents aren't moving, the staff aren't moving, the staff are serial tested, the residents are serial tested. But in businesses like the Delta, in a hotel setting, obviously we are offering very similar testing in terms of every several days, and the prompt team is working with us. And of that 25 that are linked to the Delta, some of them actually never were inside the Delta. Again, they're associated to that cluster because the transmission happened from the original cases elsewhere.
Ms. Brown, do you have a follow-up?
I'm wondering how many cases have now been connected to the Hilton, and if a prompt team has been sent there.
I know they started testing, but I know the guests and patrons have been able to get tested by going online or going through 811. My understanding is the staff are being tested very similar to with the prompt teams, although I feel like it's extramural that's helping out at the Hilton as opposed to the way that it was working at the Delta. But again, very similar in that the staff are being offered testing every couple of days.
Thank you, Ms. Brown. Tom Bateman, Brunswick News.
Good afternoon. Dr. Russell, has there been any evidence of COVID-19 transmission in any of the other isolation hotels?
No.
Next question, Mr. Bateman.
Great. Again, for Dr. Russell, I wonder if you've been asked for, or if you've been provided any advice to government about the utility of a paid sick leave program to try and help prevent the spread of COVID-19. I know there's 800 and some people now isolating. That's a lot of people.
Actually, coming back to your other question, Tom, I'm actually going to have to get back to you on whether any other isolation hotels had a case. I mean, there's possibility that some people became positive while they were in an isolation hotel. Whether or not that they actually transmitted or not, I'm going to get back to you on that.
Follow-up?
you want my
No, I didn't answer the follow-up. I'm going to leave that to Minister Cardy. I'm going to leave that to Minister Cardy.
Yeah, I mean, it's always one of those difficult positions for anyone who is providing medical advice to government and cabinet, that we should never be trying to politicize her statements or instructions or guidance that she offers. I can tell you that over the last year and a half, that we have had a government and an all-party committee that's, I think, equally important to highlight, that has consistently listened to advice around public health guidelines. And absolutely, there are conversations back and forth on all sorts of different policy areas, but the guidance we've received from public health has allowed us to be one of the best places in the world to have lived through this awful pandemic. And so for that, our province owes Dr. Russell and her team a debt of thanks.
Thank you, Minister. Thank you, Mr. Bateman. Tim Roselle, Global.
Thank you, Bruce. My first question anyway, is for Dr. Russell. Just wondering if there's a tipping point identified for when you may have to tighten restrictions in Fredericton if the situation doesn't improve there, and if if in lieu of that, if we may see something like what we saw with the outbreak in Edmonton, where there are more resources allocated to that region to try and get more people vaccinated to stem that time.
Great questions. For the first question, we are evaluating every day. We meet twice a day to exchange information on all of the different aspects of our response. And we have recently met with respect to the actual triggers for phase changes. So more to follow on that. But certainly it is a very concerning situation, especially with more public exposures happening. And again, the risks of transmission with the India variant being so very high.
Thank you. Did you have one or two? Follow-up, Mr. Roselle?
Yes, please, for Minister Cardy. And Minister, you may have addressed this a little bit in an earlier question, but you had mentioned in your remarks that when the eligibility for vaccines drops to the ages of 12 plus, you had said that you want to make it as easy as possible for that age group to get vaccinated. And the earlier question mentioned the possibility of in-school clinics. You mentioned some hurdles there. What would the major hurdles be to potentially doing something like that?
The major hurdle is that the Pfizer vaccine does not last for very long outside of very, very cold deep freezers. And those are already in not great supply across the province. So it's just a question of logistics more than anything else. It's how do we get the shots to the students or the students to the shots. So the obstacle to having an in-school clinic is exactly that, just the risk of wasting doses, which is, I think, one of the the worst things that can happen right now as we try to get everyone vaccinated before the variants take hold. That's the concern. So it's really a logistical issue, and we're going to do our best to figure out the most efficient way to make it as easy as possible for parents and for the young people who can get there on their own to get their shots.
Thank you. Justin Dupuis, l'Acadie Nouvelle.
Oui, bonjour, la question pour le ministre Cardy. Juste un bref retour sur la vaccination des 12 ans et plus. Vous avez parlé des défis logistiques de vacciner à l'école. Si jamais la vaccination n'a pas lieu à l'école, est-ce qu'il y a des bonnes chances que ça puisse quand même être fait avant la fin de l'année scolaire?
Mais on va absolument, on a encore 5 semaines avant la fin de l'année scolaire. On va faire tout qu'on peut pour assurer que le plus grand montant des élèves sont vaccinés. On a accès à un vaccin entre ici et la dernière semaine de juin. Mais ça dépend encore beaucoup sur les questions de logistique. À cause du fait que le vaccin Pfizer ne peut pas survivre hors d'un congélateur pour une longue période de temps. Alors, c'est ça qui impose les restrictions sur notre habilité d'avoir les cliniques dans les écoles, par exemple. Mais on va voir qu'est-ce qu'on peut faire et on va probablement avoir un système aussi qui, j'espère qu'il va être assez simple que pour tout le monde dans la province pour voir, OK, maintenant c'est le temps pour avoir mon enfant, 12 à 18 ans, d'avoir leur vaccin. Ceci est le plan. Alors, on va partager cette information dans les journées qui arrivent. Merci encore pour les questions.
M. Dupuis, as-tu un suivi?
Non, c'est tout, merci.
Merci beaucoup. Adam Bowie, Daily Gleaner.
Hi, this is a question for either the minister or Dr. Russell. with recent cases at 4 Fredericton area schools, has any consideration been given to a citywide move to online learning or a temporary closure or directives on increased ventilation, such as opening windows, doors, anything to try to sort of reduce risks of potential spread?
I'm going to take that one, Adam. So our approach with EECD in terms of all the public health planning and operational plans really includes if there is a case associated with a school, then they do close for operational reasons if necessary, for contact tracing or absenteeism, et cetera. And with respect to student-to-student transmission, it's very rare. I think if it has happened, it may have only happened once. So the protocol is in place, if that, again, it's very, very rare in terms of all the data we have here in New Brunswick. So we're comfortable that our protocols thus far have worked and will continue to work. If we were to see something change or something dramatically different, then obviously we would adjust and pivot and respond as necessary. But at this point in time, I'm comfortable with our continued approach. Again, it has been successful up until now, and we've managed to contain outbreaks, any outbreaks or any cases related to school settings. But again, we're dealing with variants, and we do get new information every week, every day, and if we do need to make changes, we absolutely will do so.
I'll
You have a
follow up.
follow-up? Oh, you're adding, sir? Hang on.
Whenever. Just to reiterate what Dr. Russell said, that we are one of the only places in the world where we've had a school system that opened on time and has broadly stayed open with very few changes, except in response to localized outbreaks of COVID throughout the entire school year. And that was because starting this time last year, even earlier, public health and the officials at Education and Early Childhood Development worked on a really strong plan that put the focus on making sure our schools could stay open under as many different conditions as possible. And so far, that's, as the doctor said, has worked very well. And we won't hesitate, if we have to follow the advice from public health to move schools online. And that's why we've put the investment in place there. So that's not a decision that involves cost or chaos. We're ready to go, but we don't want to do it unless we have to. So we won't do it unless the doctor recommends it. And I'm certainly hoping, and I know everyone in Zone 3 is hoping, that with proper following of public health guidelines around COVID for the next couple of weeks, we can put this outbreak in the capital city behind us, and perhaps that'll be the last one before we reach the end of the pandemic.
Thank you. Mr. Bowie, do you have a follow-up?
Just quickly, I'd say, has there been any consideration, given the wide risk or wide variety of public exposures in Fredericton area recently, to going to an orange phase or something like that to try to slow those down?
Hi, Adam. So public health meets regularly with all of our partners to discuss those risks. We do have in-briefs and out-briefs twice a day around all the different things that contribute to our triggers. So they're monitored very, very closely. We did have a meeting today to discuss all the triggers. And if we have any recommendations, then you'll hear about those. And then just coming back to the school issue, based on all of our phases, as Minister Cardy said, we really tried to make sure that in most phases, with the exception of lockdown, that kids could attend school. And again, because we knew that the education component, the social determinants of health, mental health, et cetera, were so beneficial, that we wanted to protect those things as much as possible while mitigating the risks of COVID-19.
Thank you. Before we go back, Hidil Ibrahim, Dr. Russell has some information for you concerning McGee.
Yeah, so the Regional Medical Officer of Health did confirm that the remaining McGee House residents have been released from isolation, and they were released on the 16th of May.
Thank you. Bobby Jean McKinnon, CBC.
Yes, thank you. Dr. Russell, what does the modeling of the outbreaks in the Fredericton region show, and is there any evidence from the contact tracing you're doing that the existing vaccination rate is keeping the spread lower, with clear examples of breaks in the transmission?
Great question, Bobby Jean. We do have information around the pattern of transmission that we're seeing and whether or not people are vaccinated. again, we're monitoring that. There's nothing really telling us right now that vaccination is playing a huge role, because obviously, as you know, Bobby Jean, you have to have that first dose on board for at least 2 weeks before immunity is conferred. I think what we are watching very closely is if the cases that we have had, if they are going to become hospitalized or not. And there is always a lag time between the time that somebody becomes infected and has symptoms and the time that they then would require hospitalization. So we're probably a week away from really being able to make that determination.
Ms. McKinnon, do you have a follow-up?
Yes, I do. Thank you. This would be for Dr. Russell or Mr. Cardy. Last Friday, the superintendent of Anglophone West told families the potential exposure at New Maryland Elementary School Wednesday was deemed no longer a risk, but then last night, families were notified a positive case has been confirmed at the school. So is this new case the result of the same exposure, or what happened here?
Hi, I'm going to take that. So as you know, when there are outbreaks or cases linked to school settings, we test the staff, we test close contacts, et cetera. And as you know, those tests are a snapshot in time. And so somebody could test negative and then test positive within that 14-day period after exposure. So in this particular case, that is what has happened.
Thank you, Ms. McKinnon. Gilles Duval, TVA. Gilles Duval, TVA.
Ah oui, bonjour.
Bonjour.
M'entendez?
Toujours.
OK, parfait. Question pour Dr. Russell. Il y a des gens actuellement qui décident de ne pas se faire vacciner. Alors, lorsque ces gens-là vont peut-être réaliser qu'ils vont être privés de faire certaines choses, ils vont peut-être décider d'avoir accès au vaccin. Moi, je veux savoir, est-ce que vous avez planifié, par exemple, si ces gens-là décident, une fois que la première et la deuxième vague de vaccination seront faites, s'ils décident tout d'un coup là, qu'ils veulent avoir le vaccin, ou même si pendant qu'on est dans la deuxième vague, puis eux décident de l'avoir leur première dose, est-ce qu'il y a une planification qui est faite pour, appelons-les donc, les retardataires, là?
Il n'y aura pas de problème pour planifier d'avoir un vaccin n'importe quand durant les prochaines 3-4 mois, parce que d'ici au 1er septembre, c'est dans ce temps-là qu'on voulait avoir toutes les gens qui veulent être vaccinés de prendre leurs 2 doses. Alors, s'ils prennent leur première dose dans le mois de juillet, il n'y a pas de problème. Ils vont avoir la chance à faire ça. Ils peuvent avoir leur deuxième dose à la fin de août. Pas de problème.
Tu es suivi, M.
OK.
Duval?
Ben, juste, mettons hypothétiquement que quelqu'un décide dans plusieurs mois, puis vous avez terminé la première et la deuxième vague de vaccination, mettons qu'en début de l'année 2022, quelqu'un dit je vais avoir mon vaccin tout d'un coup, est-ce qu'il va y avoir une façon que ces gens-là vont pouvoir y accéder rapidement?
Je dis oui, sauf que la seule chose qui éviterait la possibilité d'être vacciné dans ce temps-là, ce serait si on a des doses du vaccin et s'ils ne sont pas expirés à ce temps-là. Et aussi, s'il y a des nouveaux vaccins contre des variants, s'ils sont développés, peut-être il va avoir quelque chose de différent à ce moment-là. Mais moi, je n'ai pas d'inquiétude que les gens qui veulent être vaccinés n'importe quand pourraient être vaccinés dans le futur, sauf que s'il y avait des problèmes avec recevoir des doses au niveau national ou si c'était les doses qu'on a sont expirées.
Merci, M. Duval. Merci, Dr. Lindsay Armstrong, all Nouveau-Brunswick.
Hi there. A question for Dr. Russell. You've spoken a little bit about the 75% immunity threshold. I'm wondering if that will be the province's target for reopening following federal recommendations, or will the province go for a higher eligibility immunity rate, like 85%, as Dr. Strang has said Nova Scotia will do for reopening?
I know we're in the early phases of planning right now, so I can't really comment on that at the moment.
Yes, as the doctor was saying, this is something we are absolutely working on. So I want to reassure everyone that despite the fact that we're facing an outbreak in Fredericton, that plans to get us out of the pandemic, to relax restrictions, to let a normal life resume are the reasons why we're all going through all of this. And so we'll absolutely share details as soon as they're shareable. We've got a ways to go. We're looking at like we're going to hit 50% of vaccinated New Brunswickers, at least with their first dose, sometime this weekend. So then we've got another 25% to go before we reach Dr. Russell's target. And in the meantime, we'll be working hard not just to control the disease and to make sure that we're dealing with any outbreaks that pop up, but also making those longer range plans. So we are absolutely working on it. It's a priority, and I can't wait to sit here or watch on TV when that announcement is made, because that's going to be the reasons why we've gone through so much and people have struggled so much and lost so much over the last year and a bit now.
Ms. Armstrong, do you have a quick follow-up?
Yes, thank you. I recognize reopening off the table at this stage, but I'm wondering if you can tell us a little bit more about what you will be looking for before that can happen.
So just as we've had triggers for closing things down, we do have preliminary triggers for opening things up. There is input at the national level because we've had those conversations at the national level, but New Brunswick and Atlantic Canada are pretty unique compared to the rest of the country. So I think there would be some similarities to what we would be thinking about moving forward compared to overall at the national level. But I think there will be a lot of things that are going to be unique to New Brunswick and Atlantic Canada only because we've had different restrictions, travel limitations, border restrictions, et cetera, with respect to what has kept COVID-19 cases low here. As we get our population vaccinated, we will continue to need people to be tested. So there will always be a positivity rate that we will want to maintain with respect to testing. And there are some other criteria such as, again, the percentage of the population that is vaccinated with 2 doses as opposed to 1 dose, et cetera. So things like that will be taken into account.
And this is one of those times too where this isn't something abstract. This isn't just folks from the government saying, you know, this is what must be done. We know how we're going to get to the point that we can remove restrictions. It's when people get vaccinated. So if you wake up in the morning and are annoyed about having to put on a mask and annoyed you can't go close to people who you're like to be closer to, and you want to put an end to this, first question, do you have your vaccine? And as of a couple of days from now, if you're over 12, get your appointment to get your shot. And talk to other people, talk to your friends, talk to your family. If you've got folks who've got questions or concerns about the vaccines, reassure them. After you've had your shot, talk about how effortless it was. Because it's by reassuring people, by saying we're in this together, by showing we're in this together, that's how we get through this. So just a few more weeks to go, but this is where everyone watching right now can make a difference. Get your shot, encourage those around you and those you talk to do the same.
Back over to Dr. Russell, please.
Yeah, I'll just add one comment that throughout the pandemic, our goal has always been to avoid having our hospital system be overwhelmed. We know that in places like the UK and Israel, where most of the population has had their 2 doses of vaccine, they do still have underlying rates of hospitalization. And for New Brunswick, obviously, that number of cases that will need hospitalization will be very, very important in terms of keeping an eye on what our capacity levels are, as it has been throughout the pandemic. So that'll be another factor in terms of what can open up safely and which restrictions can be removed.
Thank you. Thank you, Ms. Armstrong. Aaron Sousa, Huddle Today.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, the Prime Minister announced earlier this afternoon that Canada will receive its largest vaccine shipment this week, sitting around 4.5 million doses. I was just wondering if you had any insight on how many of those doses New Brunswick can expect?
The only information I have is that the distribution is based on is on a per capita basis. So each province would be receiving amounts based on the population of their province or territory.
Follow-up, Ms. Sousa?
Yes, thank you. Also for Dr. Russell, just as for the latest death in the Edmonton region, can you confirm if that individual was immunized against COVID-19?
I don't have that information, but I can check. And again, when we look at the patterns of transmission and immunization, we'll definitely be able to paint a picture as things evolve, but we're also looking at data from other countries that have had their populations vaccinated, but I will look into that for you.
Thank you. Maude Montembeau, Radio-Canada.
Oui, bonjour. Ma question est pour Dr. Russell. Dr. Russell, pouvez-vous nous dire d'un point de vue de santé publique pourquoi, à l'heure actuelle, mis à part la situation en Nouvelle-Écosse, il est impossible d'établir une date pour la réouverture de la bulle atlantique?
Très bonne question. C'est vraiment dépendant sur à quelle vitesse qui peut réduire les nombres de cas actifs à Nouvelle-Écosse à ce moment-ci. C'est vraiment intéressant de voir comment vite que les mesures en place sont effectuées et on voit les résultats. Mais je crois que ça va prendre plusieurs semaines avant que ça va être réduit d'un nombre de cas qu'on peut vraiment prévenir la bulle atlantique et un changement de restriction de voyage.
Tu es suivi, Maude?
Oui, par exemple, ici au Nouveau-Brunswick, quels sont les critères qu'il faudrait qu'ils évoluent et dans quel sens devraient-ils évoluer pour que ce soit assez positif pour qu'on parle de rouvrir la bulle?
Je n'ai pas tous les détails exacts, mais je peux vous dire que les équipes d'épidémiologie de chaque des 4 provinces atlantiques, ils ont des réunions chaque semaine pour discuter tous les nombres de cas, la transmission, les variants, etc. Et même, on suit les taux de vaccination aussi. Alors, toutes ces choses vont faire partie de l'analyse et la discussion d'ici dans les prochaines semaines, mais je crois que encore pour voir les nombres de cas à Nouvelle-Écosse descendre le plus vite que possible, ça va être quelque chose qu'on va surveiller.
Merci, passez une bonne journée.
Merci, Maude.